home health care industry in New York has long relied on an opinion letter issued by the New York State Department of Labor on how to pay home attendants who work 24-hour live-in shifts. The Department of Labor described in the opinion letter a method of payment that actually allows them not to pay for certain hours not worked, such as sleep time or meal time, if certain markers of how many hours off they get are met. So now in this case, the Appellate Division Second Department in New York, following an earlier decision this year by the First Department, ruled that that opinion letter contradicted a wage order and should not be given deference. The result of that was the courts ruled that these attendants had to be paid for all 24 hours spent on those shifts, whether they got the time off or not. The appellate divisions in New York are intermediate appellate courts. The highest court in the state is the Court of Appeals, so appeals still may be taken to that court. However, the Court of Appeals has not in prior cases ruled on this issue, so it's hard to predict at this time what the outcome may be. In the meantime, two federal courts in New York this year have ruled on the identical issue and found that the opinion letter of the Department of Labor was entitled to deference because it did not conflict with the underlying minimum wage order. Now, those decisions may not be binding on the Court of Appeals, but perhaps the reasoning in them will influence the outcome of the case on appeal.